Hello everyone, this is Dr. Abinaya Vijayakumar. I am a doctor and a motherhood empowerment coach. Pregnancy is something very beautiful which always puts smile in faces and happiness in hearts. Let's get to know more about what is a pregnancy test, what is the logic behind it, what are all the samples that you can test for pregnancy and when you should do it and what are the different results that you get out of it. First and foremost, what are all the samples that you can test for pregnancy? One is your blood sample, second is your urine sample. Urine pregnancy test is very popular and is available in all the medical shops. So when to do this urine pregnancy test? So it should be a morning sample. You can do the pregnancy test in the urine sample throughout the day as well, but the morning sample has higher concentrated urine, because of which the beta HCG levels in the urine is higher, and so you get the chances of getting a positive result much more. The next sample is the blood sample. This is usually done in laboratories and hospitals where they draw a sample from you, and this test is called serum beta HCG levels. So what is this beta HCG? When sperm and ovum successfully fertilizes and forms an embryo, the fertilized embryo secretes beta HCG hormones. This is circulated in both blood as well as in urine. The most common test that we do is, as discussed earlier, is the urine pregnancy test, where we measure the urine beta HCG levels. The next one is going to be in your blood, which is the serum beta HCG levels. Next, when can you do the test? Not always every woman will get the pregnancy test positive at the 31st day. Don't get me wrong, but this is true. Every woman has a different cycle. Some women has 25 to 30 day cycle, some women has 30 to 35 days, some women has 45 days or even 60 days or even more than that. Not all the women will test positive on 31st day, and that doesn't mean you are not pregnant. So when should you do a test? If you have a regular periods of 25 to 35 day cycle, when your normal cycle length is missed, always test 1 week after the missed periods. And if it is more than 45 days or 60 days cycle in you, anywhere after 50 days of not getting your periods, you have the symptoms of pregnancy like vomiting, nausea, tiredness, then you can definitely go for a urine pregnancy test or a serum beta HCG levels. And if you don't get the positive result at the time I have mentioned earlier, don't get immediately stressed out or disheartened. Kindly repeat the test 1 to 2 weeks later if you don't get your periods, so that there is a high chance that the pregnancy test can become positive. While discussing about this, we should also remember that there is a condition called faintly positive. Whenever you get a mild pink line, second line, mild when compared to that of the control test, then it's ideal that you repeat the urine sample or urine pregnancy test after 3 to 5 days, and there are high chances that it will definitely turn out to be positive. Can a urine pregnancy test be falsely positive or falsely negative? What is that? Falsely positive, that means the woman is not actually pregnant, but the test shows double line, which is indicating her pregnancy. When can this happen? If a woman is having ectopic pregnancy, which is anywhere outside the uterus, in ovaries, in tubes, or outside the ovaries, that could be dangerous for the woman's life itself. Second is the molar pregnancy, which is not actually a pregnancy, but it is like a grape-like structure which is formed. Third, in some types of cancers like choriocarcinoma, there can be high levels of beta HCG, which can result in a urine test positive. Fourth, there can also be a chance that it can be a biochemical pregnancy without actually being pregnant. So in such cases, an ultrasonogram, that is the ultrasound, will be the confirmatory test to see if it is actually the normal pregnancy or the other way, as I've discussed earlier. What is false negative? Here, the woman is actually pregnant, but the test results are showing negative. When can it happen? As I told you earlier, if a woman has a cycle of 40 to 45 days and she's checking in a period of 30 days after her last periods, the test can be negative. Or if she's checking on the day as per her cycles, for example, her cycle is 40 to 45 days and she's checking exactly on day 45, it can still be negative, because sometimes it can be delayed ovulation, because of which the pregnancy test can show us negative. In such cases, the blood serum HCG levels can be a confirmatory test, as well as repeating the urine pregnancy test itself after 3 to 5 days can show a positive result. Nevertheless, ultrasonogram will always remain the confirmatory test. With this, I hope that you have got the concept behind the pregnancy test, what is the logic, when to do it, how to do it, and what are the different samples that you can test, and what is false positive and false negative. If you like this video, do subscribe to my channel and press on that bell notification so that you don't miss out on any upcoming videos in this channel. Also, do like, comment and share it with your friends and family, and also to the women in your friends and family who is a mom to be very soon.